I'm Marina Epstein. I am not Jennifer Bailey, as previously advertised. Jen is chairing another panel that is set at the same time. So I'm going to give her talk. So most of us know that, on average, youth who initiate alcohol use in adolescence are more likely to go on to report misuse or alcohol problems later on. And on average, this is very true, and it's a strong and robust finding. However, that doesn't necessarily apply to every last youth, and that we know that along with a lot of continuity, we have discontinuity as well. So we have discontinuity in onset. So these are youth who had no problem drinking in adolescence, who either do or do not develop alcohol problems in young adulthood. And then we also have desistance. Youth who had reported alcohol problems may go on to then no longer report problems at age 25. And we're interested for this study in factors in young adulthood that might explain these discontinuities. And I recognize that there are many, many factors that in adolescence and throughout the lifetime that are likely to play a role here. But just for this, this limited time, we're going to talk about young adulthood. And so when we think about, we hypothesize what are going to be the important factors that may explain discontinuity. Transition to adult roles is going to probably be a big player. So things like marriage, parenthood, employment. Throughout this talk, I'm going to use yellow for kind of risk or bad things, and green for protection or good things. So while marriage, parenthood, employment are likely to be deterrents for problem drinking, something like going to college is an interesting one, because going to college is a risk factor for alcohol use, but then at the same time going to college is a protective factor. People go to college, get jobs, and employment is could be a protective factor. So we'll have to keep an eye out for that. Interpersonal relationships, conflicts with your family of origin, if you have a partner, conflicts with your partner may be related to the onset of problem drinking. Mental health problems that have emerged since adolescence, and other stressors like financial problems or exposure to violence that have occurred since adolescence could bring about an onset of problem drinking. And if we turn these things around, each one of these could be a protective factor for desistance. So your support from your family of origin or your partner, experiencing low depression or anxiety symptoms, the things that have alleviated since adolescence could predict desistance. And as you heard, we have an international sample, and it's a cross-national comparison, and that there are reasons to think that there may be state differences in these relationships. And so I'm going to show a few of these. I think you've seen some of these already in Rico's slides, so I'll just go over those fast. So I just want to define alcohol problems in adolescence. These were things like, have you ever gotten into a fight, because you were under the influence of alcohol? Did you ever have sex with someone you didn't want, you then later regretted? Did you ever get so sick that you passed out or threw up? So things like that is what we're asked of the adolescents. At age 25, we measure misuse through the audit. And so anyone who was classified into the high-risk drinking in the audit was coded as having alcohol problems. And so not entirely surprising. So Rico was talking about how the harm minimization policies were expecting that youth rates of use would increase, but they were also expecting the levels of problems would not necessarily be increased, right? So you teach someone to drink responsibly, then they're going to drink responsibly. They're not going to binge drink, except you just saw from Rico's slides they do. And from this analysis, you can see that they also reported, the youth in Australia and Victoria reported far more alcohol-related problems. And then, not surprisingly, also more likely to meet the audit criteria for risky drinking. There was, I think you saw this, more marriage, more parenthood in Washington. No difference in family of origin or partner conflict. No difference in depression and anxiety. And no difference in violence exposure, but more financial difficulty in the Washington sample. So, coming back to this idea of discontinuity, how much discontinuity do we see? So in the full sample, 18% of adolescents reported onset. So 18% of those who did not have alcohol problems in adolescence went on to have alcohol problems in young adulthood. And good news is there was a whole lot of desistance. So of those adolescents who reported problems in adolescence, 68% of them were no longer reporting, did not meet the criteria for the audit risky drinking. So that's great news. Looking at it by state, what you see is there was more onset, 23% versus 14% in Victoria, and there was also less desistance, so 63% than 75%. So I'm going to come back to this slide just to remind you that the way we're theorizing this is there are going to be 4 states, right? So there's continuity, no, no, or yes, yes. So those are 2 states. And then the 2 discontinuity states, the onset, no, yes, and the desistance, yes, no. And the reason I'm talking about this is because the analysis is a multinomial logistical regression. And so what happens in this type of analysis is that all 4 of the states are the outcomes. So we have our focal states, the onset and desistance. But then the continuity, the no, no, and the yes, yes, are also in the model. So all 4 of these are in the model, and one of them is a referent. And you will see that the 2 different continuity states will be serving for reference differentially. And then the predictors are the things that I already showed you: the transition to adulthood, married, parent, college, employed, conflict, depression, anxiety, violence, exposure, financial difficulty. We controlled for being female and being white. And then we also have the main effect of state in this. So the first analysis is going to be on onset, so predicting onset. So again, as I mentioned, all 4 of the states are in the model. But we're just going to look at this comparison, right? So we're comparing people who developed problems from those people who did not develop problems. And the only risk factor for onset that we found is depression and anxiety. This is in the full sample. On the other hand, we had several protective factors. So being married or being a parent predicted less onset. The state is actually, I think I have it labeled wrong, it's the Washington state. So those living in Washington state were reporting less onset, and females are reporting less onset. So because we have this main effect, we wanted to look at this a little closer and wanted to look at separately in the 2 states to see what we can find. And so in Victoria, you can see that being employed emerged as a risk factor, as an additional risk factor over depression and anxiety. And then, again, being married, being a parent, and being female were protective factors. In Washington state, only depression and anxiety was a risk factor for onset. And being married was not a protective factor in just the Washington sample. So just to recap, being married was not a protective factor in Washington. Being employed was a risk factor for onset in Australia. And then depression and anxiety was universally a risk factor. Okay, so let's talk about desistance. And I saved the more hopeful things for after, the good news after the bad news. So again, we have all 4 states in the model. We're only going to look at the comparison between those who desisted from those who did not desist. And in the full sample, what we see is being employed was a protective factor for desistance. And again, depression and anxiety was, a risk factor. So less desistance, which is a risk factor. And depression and anxiety was, again, a risk factor. I will say that we do not find a main effect of state in this particular model, but we did look. And employed was a risk factor only in Victoria, not in Washington. The protective factors are the same: being married, being a parent, being female. So a quick summary: there were some notable differences in just the levels in marriage and parenting. There were more of that in Washington than in Victoria. And then in Victoria, we had more college completion. And in terms of risk and protective factors for onset and desistance, well, luckily, they're kind of exactly the same. So depression and anxiety, universally a risk factor in both states, a risk factor for onset, more onset, a risk factor for desistance, less desistance. Marriage, parenthood, and female gender were protective factors. These are not exactly things we can intervene with, unfortunately. I don't know if any of you saw the movie The Lobster, but they assign you a partner, and they say, if you're having any trouble, we will assign you children. And in Victoria only, employment was a risk factor, and that is something to look at. Perhaps Sabrina's talk will shed some light. So again, prevention implications, yeah, we cannot assign children and marriage, but we can intervene with depression and anxiety, right? And we can intervene with that early to reduce the incidence of onset, and we can, intervene in young adulthood to reduce incidence, to promote desistance. And yeah, this workplace alcohol policy, I don't have anything to contribute to that particular thing, but stay tuned. Thank you.